The science is no longer unavoidable. The climate is changing. These changes are creating new health risks in our communities. Extreme weather and disease outbreaks are becoming more and more frequent and even more severe, affecting more people in more places. These changes in our climate mean our communities need to prepare for the associated consequences like frequent disease outbreaks, displacement, and food insecurity. The extent and magnitude of climate change impacts are larger for each additional fraction of warming, and the impacts involve severe disruption to nature and society, reducing our ability to grow food or accessibility to clean drinking water, with the poorest communities having or likely to have a harder time coping with this change in lifestyle. Climate change acts as a stress multiplier in these regions where people have limited access to clean running water, to sanitation or health facilities and education. The livelihoods of these people are also strongly dependent on climate-sensitive activities such as farming and fishing. They have limited access to funding and accountability from governments. And because of this, adaptation to a changing climate and thus world is said to be particularly hard for these communities. Multiple climate hazards are simultaneously affecting some of these regions, with floods and severe droughts happening within the same country or region. Take the case of Uganda. While floods were destroying entire communities in the southwest, a severe drought and famine were ravaging in the northeast, made worse by the swarms of locusts. Such extremes are said to become commonplace if we continue with the status quo. Adaptation is key to mitigating the climate crisis. The UN report by the Intergovernmental Panel on Climate Change hints at the protection of nature as one of the best chances we have to hold back the worst climate hazards and rebuild climate resilience. Nature can help regulate the climate, give us clean water, and control pests and diseases. However, we cannot leave everything up to nature. A fundamental shift in our way of life is needed. Taking action now gives us the best chance of success to tackle the climate crisis. The climate, human society, and the biodiversity all influence each other. As we humans interact, change the climate, biodiversity, we inadvertently change our future way of life. Talking about risk is not enough, but looking at the available solutions to that risk, assess the feasibility and effectiveness of these solutions and how to draw them into practice, how to scale them, gives us and policymakers where the best place to act is and what direction we need to take. There is a price to pay for inaction. The planet is that price. The ecosystem is that price. Our health is that price. Our lives are that price. Our future is that price.